Hello, my name is Mackenzie and I'll be your student nurse today. Can I get your first, last name, and date of birth? I'm performing hand hygiene. Okay, I'm going to compare that to your wristband and it matches. I'm here to do a wound change on you because you just recently had abdominal surgery and you have a wound on your abdomen that has been since sutured up, but we want to make sure we need to do dressing changes to make sure no infection or drainage is sitting there because we don't want bacteria on it. So have you been experiencing any pain with this or any pain while doing dressing changes? Okay, so the patient has stated that she does experience slight pain when doing dressing changes, so this would be a time where I could go tell the provider and they could potentially give me pain medicine for her. I could administer it to her and come back in an hour to do the dressing change so it's less painful. But for video purposes, I'm going to go ahead and start the dressing change. So I'm going to move the bed up to a working height and close the curtains to ensure patient privacy. I'm going to put on gloves, and I'm going to move the sheet back off you so I can expose the wound. And I'm going to raise up your gown to expose the wound as well because we don't want anything to touch it or get bacteria in it. So I'm going to start removing it by pulling up the edges. And I'm going to grab from the center and pull up, and the gauze is already in here, so it's just the fresh wound down now. There is no drainage, it is dry, it is intact. I note about, there are 7 sutures, it's about 4 to 5 inches long, and it seems to be healing nicely, so I'm going to throw away the old dressing, take off my dirty gloves, and throw those away, perform hand hygiene, and put on new clean gloves. I'm now going to begin with a sterile field. I'm going to open up my dressing change tray and get the drape out. Making sure to only touch the 1-inch border and not let it hit anything else. Now I'm going to dump the contents onto the tray without touching the drape. If I was cleaning this wound with gauze, I could put sterile saline in here to help clean it, but I'm not for this purpose. I'm just going to be using swabs, so I can go ahead and get rid of this. Now I am going to open up my swabs, go this way, making sure to only touch what is not sterile. So I'm going to get my first swab and clean the patient from clean to dirty, so top to bottom on the furthest away, throw away. Get a fresh one and do near me from top to bottom, or clean to dirty, throw away. And finally do the center of the wound, top to bottom. And then we can throw all that away. And now I will begin to do a new dressing on here. So I'm going to pick my gauze up with my tweezers, and place on the wound. This is my secondary dressing. Place this one on. The wound is completely covered, so I can get rid of these. I don't need my tweezers anymore. Oh, I don't need my tweezers anymore. So now I'm going to pick up the primary dressing, only touching the part that's not going to go onto my patient. And I'm done with my sterile field. Okay, so we're only touching the outside. And then we can grab our tape to tape this wound down. And if this was opened wound, you could pack gauze in there, but with it being closed, Gauze does not need to stay packed in there. And we would take down each side of the wound. Okay. Go this way. And now I'm going to be assessing the patient. Was that okay? Are you feeling okay? Or do you need anything? The patient has stated that there was slight pain, but she is okay. And I have placed the call light, and she knows that she can call me if she has any questions or if she needs anything.